Hey guys, welcome back to another episode of stonksmaxxing. Today I'm going to but more so do some research on Eli Lilly and the pharmaceutical industry. This is a company that I'm presenting for one of my classes, so I want to be able to do some research, understand first the pharma industry. I feel like this is a pretty niche industry, and maybe within the health, maybe also understand kind of the whole healthcare system, how it works, maybe on an international and national level. I think healthcare systems they are different across different countries, different nations. Maybe there's a cultural impact. There's definitely a political impact, or I guess a political portion of this too. So, that being said, I'm going to take a look at exactly what I wrote here. And I probably will need to make some flashcards to Okay, so what does a company do? Eli Lilly itself creates what they call human pharmaceutical products. And these are medical products that are targeted towards human health, mostly different types of drugs and treatments. So drugs, I think, are products that people can take in order to cure some type of disease. I don't really know the chemistry behind it, and there's a lot of different diseases in this world. There's a lot of people in this world that are suffering some type of health problem. So there's a pretty big target audience or addressable market here. Now, I do have to say, I think that this is kind of a morbid or unhuman-like way to analyze, I guess, unhuman-like. It just seems wrong to be able to profit off treating people. I don't know. Maybe it's something that is kind of irrelevant here. It's not. I'm trying to struggle. I'm struggling finding the words to describe what I'm feeling. But let's move on. So you have drugs. You have treatments. Treatments, I think, are more related towards. I'm thinking of cancer treatments. So I think that is related to chemotherapy, radiation therapy. I don't know if radiation therapy is something Eli Lilly does. It mostly has to do with chemicals. Yeah. Immunology, okay. And I guess these are vaccines, which are a bit different from drugs, because I think drugs are kind of treatments. They help treat or... Yeah, okay, I guess they help treat a disease. Vaccines try to prevent viruses. Now, there's also neuroscience products and other products / therapies. Okay, maybe therapies is the word. Erectile dysfunction is interesting. Osteoporosis. Biggest markets, I guess the biggest portion of Eli Lilly's revenue does come from I believe it's diabetes, obesity, and cardiometabolic products. I think cardiometabolic is just a fancy way of saying things that relate to our heart and also our ability to process fats and sugars. Could be wrong there, but I think that's the big idea. Okay, now there's the idea of diabetes, obesity. So what exactly is diabetes and what exactly is obesity? So, yeah, I'm not a pre-med major. I'm not a biologist or any type of chemist. So maybe my definitions aren't exactly 100% right. but I think diabetes is having elevated sugar levels or blood pressure levels. Now, I'm not exactly sure what blood pressure really is. I think it has something to do with cholesterol, but then again, I don't know what cholesterol really is. So there's kind of this gap in knowledge here. Obesity, on the other hand, I think this has to do with having a high weight to bone or body mass index. I don't know the exact measurements of what the body mass index actually measures. I don't know how it's calculated, but I think these are some metrics used to determine whether or not someone suffers from obesity. And then you have cardiometabolic products, which I think are very similar to the idea of diabetes and obesity in the sense that it has to do with your blood, your heart, and also the way that you are able to process certain types of sugars, fats. So this is the big moneymaker, Eli Lilly. Now there's also oncology products. So these are products that are used to treat cancer. Cancer, I think, is some type of disease in which you have these cells that destroy. Okay, you have cancer cells, which are kind of like the bad guys, and then you have your normal cells, let's say in your lungs, so lung cells. And I think the cancer cell will maybe not eat up, but will take over, will kind of crowd out all the cancer or all the good cells in your lung. And eventually it'll cause a big lump or maybe it'll eat up a lot of the resources that your lung cells need to operate. And that's what causes lung failure. And eventually you might die. So that's unfortunate, but Eli Lilly does have some products to treat certain types of cancer. Immunology. So I think this has to do with, I guess not. Immunology, maybe it's the same thing as virology, but it seems like these are just products that interact with the immune system. So what does that mean? I think our immune system is the portion or part of our body that helps fight off viruses and bacteria. So when I think of my immune system, I think of T cells and B cells. From my high school biology class, I don't exactly remember what their use is besides fighting off, I think maybe pathogens, bacteria, viruses. I don't know exactly how they do it, but I know that they exist. So there's also 4 commercially available products that are used to treat these types of, I guess you could say, diseases. I don't know exactly what these are, but maybe that's something I could look into. Neuroscience products. 2 total commercially available products: anxiety, depression, osteoarthritis, migraines, and headaches. Okay. So there's other products and therapies: erectile dysfunction and osteoporosis. Okay. So that's kind of a big overview of how Eli Lilly makes money. Pretty much they make and develop these products and then they sell it to end users. But I think that's what I want to go over here, and how actually these drugs are distributed, because I think a lot of these drugs, especially in the US, are highly regulated. There's a lot of regulation that goes on in the healthcare market, and that's something that will definitely have an impact on how they distribute their products. Okay, so let's take a look at the end market. What I mean by end market here is who's actually using Eli Lilly's products. And in this case, it's the patients that are suffering from some type of disease, whether it's diabetes, cancer, erectile dysfunction. These are the guys that are using the drugs. Now, how they actually get that drug is a whole different other question. I think this is where the so-called middle market comes in. So people buy stuff from Eli Lilly, and sell it to end markets. Alright, what did I write here? The case of the pharmaceutical industry, wholesalers dominate the middle market. These wholesalers sell products to physicians, pharmacies, and other healthcare professionals such as hospitals. Okay, so I'm going to add something here in front of the end market. Maybe a step above the end market is the doctors, healthcare providers, hospital, urgent care, and pharmacies. Okay. So I guess within the healthcare industry, there's this idea of wholesalers that kind of act as a middleman that sell products to physicians, pharmacies, and other healthcare professionals. What I think that these wholesalers do is they buy inventory from Eli Lilly, kind of like how Walmart might buy things from the Lego company, and then Lego company will sell products. Walmart will sell the Lego products within their stores. I think maybe that's a similar idea of how these wholesalers operate. Okay, Eli Lilly distributes his products. There's a team of internal sales reps. These guys can target physicians and offer incentives for prescribing certain drugs. That might be kind of fucked up. Wholesalers, we have McKesson, Cencora, Cardinal Health. These guys mostly operate in the U.S. healthcare system, online advertising. Okay. So competition in the pharmaceutical space is fierce. There are lots of companies that are innovating and creating new products. It's fair. There are threats of biosimilars, drugs that are really similar, and generic drugs that are exactly the same. The way to stay competitive in the pharma industry to develop new products that are protected by patent. Generics and biosimilars are huge risks for companies that are innovating new products. Governments sometimes require that there be generics for new drugs and products to make them more affordable for patients. Okay, maybe some things to look for. What is the market for generics and brand names? Okay, and then also, I want to add one thing here. One thing to note is that companies, pharma companies like Eli Lilly spend millions of dollars lobbying in Congress. I think what I mean by lobbying, and what lobbying really does, it's a bunch of lawyers and maybe politicians that will try to influence decision making in Congress, hopefully to offer favorable operating environments for Eli Lilly. So source here is going to be Open Secrets. Okay. One thing I do want to understand is, how does the pharma company work? Pharma industry work? Maybe how does the healthcare sector work? Okay, so let's try to think about what I know first. Maybe develop a framework. This is something that some consultants came to my school today, and they were talking about developing frameworks for these case-like interview questions. So I don't know if this is really a case interview, but I want to be able to think about certain questions and develop a frame of mind for thinking through them. So when I think about pharma industry, I'm going to think about, okay, what is the market size? What are the competitors? Maybe the barriers. market size, profitability. So those are two things. And then the products that are actually offered, the competitors, regulation, and let's say geopolitics. These are maybe some things I want to think about here as I go through my research about the pharma industry. First off, what is the market size? What is the profitability? Is this a profitable industry to be in? And I'm going to use some educated guessing here and say that it is very profitable and that the market size is huge. Products, I'm sure there's a wide array of products. Competitors, also a wide array of competitors, regulation, geopolitics, and then maybe market dynamics or industry dynamics. So how do people buy? Okay, maybe we'll talk about product distribution, product development, and then maybe supply chain. Supply chain is also interesting too. Okay, so now let's think about the market size. Just based off some stuff that we kind of already know. There's about 8 billion people in the world right now. And eventually all of us are going to die. All of us are going to have different types of healthcare problems. So I'd say that the market size really is everyone in the entire world. Everyone needs to have access to good healthcare, good treatments for any types of diseases. I'm sure that there's not a single person who's living or dying that hasn't had some type of illness before. So the pharma industry, so let's say 8 billion people in the world, estimated 8 billion people in the world. Let's say our source, I think measured by UN and US Census Bureau. Realistically, to some extent, everyone, say the pharma industry targets everyone. So then we might have the discussion about, okay, we get that everyone needs access to good healthcare, a good healthcare system. What does Eli Lilly specialize in? So they specialize in pharmaceutical products with specific types of diseases. Okay, let's say what diseases? I don't know what the word for this is. So maybe patients at risk. So we have diabetes and obesity. Let's say health metrics. And this is where I would probably want to look at how many people are affected by, let's say, cancer, diabetes every single year. Let's say today, and maybe the projected growth. Now, it kind of sucks that you have to think about projecting how many people are going to have a health problem in the future. When you think about that increasing, that does feel like it kind of sucks. if you do think that more people are going to have some type of health problem in the future. Now, I do think that there's been this uptick or uptrend in people getting cancer, especially at a younger age, maybe due to environmental and habitual types of factors. So that's also a different topic to really think about here. People affected by diabetes, obesity. Okay. Okay, profitability. So I'm gonna come back to this because I feel like this has to go with products, and I'm gonna be honest, I don't feel like I have a full understanding of how the product cycle works. When I say product cycle, I kind of mean how products are developed and how they're sold. Okay, so let's go to this then. So with the products, maybe there's this idea of, ooh, someone's playing the piano right now, so hopefully it's not too loud. Let's see. Okay, so with the products, I know at least in the US there's a lot of regulation here, and one of the main regulating bodies this here is FDA. So this approves drugs in the US. Okay, approves drugs in the US. All pharma products regulation in order to be sold. Okay, so I think how the product life cycle might work then. Life cycle. So drug is developed from novel research. I think what happens is novel research is usually funded by public dollars. So NIH grants, novel research happens both at the university level and the private Okay, so research is usually funded by public dollars. That's something that I read in a primer, but let me move real quick. Okay, I'm gonna stay in this room, but just wanna move a bit further so I could. Okay, just so I can get some space here. Okay, so this I found from a primer on the pharma industry. I think it came from a more democratic, left-leaning think tank. So there were points where the primer felt a little bit political. Primer on pharmaceutical industry. Yeah, Public Citizen 101. Public Citizen is, I believe, a think tank founded by Al Gore, which I believe was one of the Democratic candidates for presidency against President Bush. So yeah, he had some pretty, or I'm not too sure if it was him directly, but the authors had some pretty bad things to say about the pharma industry. Okay. So, big pharma, larger. Let me see. I'll say this, I'll add this here. So university research can be spun off into new pharma, into small pharma companies. Okay. The next bullet point I want to talk about is small companies get wired by large companies. So, smaller companies with promising drugs/products are usually sold to a large pharma conglomerate with billions of dollars in sales. So this happens even before drugs receive approval. Okay. So I think there's also, when you think about the development process, there's also the drug approval process. So drug needs to be approved by a national regulation agency. I don't know exactly what goes on during this process. This is probably something that gets pretty technical, and something that I probably need to do a bit of research in. Okay, so that's that. Then you have drugs need to. So I know this. I know that once they are approved, they need to go through clinical trials. So approval is just the first step. Clinical trials is the second, just to make sure that, hey, look, this actually works. So drugs need to go through clinical trials. And so there's multiple risks that are involved in each of the different steps in the product life cycle in the pharma industry. Drugs need to go through clinical trials. This is where patients actually try out the new drugs and sees if it works. Do companies make money here? Yeah, I'm not entirely sure if companies do make money at this step. Alright, final step I think is full approval. I'm not too sure if there's a actual term for this, but I think after clinical trials, then drug works, maybe it performs over some type of threshold, maybe there's no risks or little risks that are involved, then this is a drug that can be marketed and sold to hospitals, doctors, different types of healthcare providers. Drugs can be marketed and sold to healthcare providers. So at this point, drugs are protected by patents and okay, so yeah, there's this also idea of patenting different types of products. So this is also a space where I need to look into patent protection a bit more, because I know there's the idea of generics and biosimilars. So these are different types of similar type drugs that try to copy or mimic what, let's say, a brand name drug can do. I think an example is, let's use Eli Lilly. One of their drugs is called, I forgot what it's called, but it has to do with diabetes. And I think it's one of the biggest brand name insulin types of drugs out there. I think what's going to happen is after the patent expires, or maybe even before, I don't know the laws behind that, other companies that aren't Eli Lilly can make a really cheaper and more affordable version of this brand name type drug, so that you have different types of options at a consumer level. Someone who actually suffers from diabetes, it's just a single drug that will cost, let's say, thousands of dollars in order to actually purchase and use. Okay. I think patent expiration. Okay, and then yeah, patent expiration is a bit weird. I don't know if this is actually a step. So find biosimilars and man, I don't know what that biosimilars and generics. Yeah, so I think this is my understanding of how products work in the pharma industry as a whole. I'm sure there's missing parts. That's something I'll get into. So with this, I can kind of go back to the profitability stage and take a look here. So my assumption is, at first glance, lots of projects are mostly unprofitable, in the sense that when you have a new research or drug idea, most of the time, it's going to fail. So you spend millions of dollars trying to research the next new drug that can cure cancer. Turns out, doesn't even get approved by the FDA. Or maybe it does, fails at clinical research or clinical trials. So, okay, let me put that down. So, drug/projects are unprofitable. They don't get approved or fail at the clinical trial stage. Now, for the ones that do make it past, I think these guys can be wildly profitable if they maybe treat a big type of addressable market. And maybe there's also this non-competition factor that plays in with the use of patents to protect this intangible type of asset. Approved, but do get approved. Are they widely profitable? I think so. Patent protection ensures little competition. So once generics and biosimilars get developed, I'd assume profitability falls. Okay, yeah, competitors. Well, some big ones I can think of. I'm just gonna name a few. AstraZeneca. Yeah, so for this section, maybe I can also write a little bit about here, but I'm just straight up listing companies that I think are also related, share similar types of products. Pfizer, Amgen, maybe Moderna, GSK, GlaxoSmithKline, NIH. Ooh, there's also health insurance. I feel like the health insurance space is also pretty big. Yeah, this healthcare sector is huge. There's different types of people involved, so there's a lot here. This is all in the U.S. The regulation, by the way. Finances, research. So healthcare in EU, China. Right. Geopolitics. Maybe some questions I ask here is, what countries have a great healthcare system? What countries do have? What are the health problems in each country? Or in a certain geographical region. So how does the government and regulation look? So some follow-up questions then. Industry dynamics is, how are products distributed? How are products developed? Supply chain. So this I'm thinking of, okay, how are products made? I guess that's also, I'm starting to think that this is probably the same exact thing as this. Okay. So then maybe this is a good starting point. Just keep in mind here. So I think there's a pharma primer. Okay, so I'm gonna take a look at this Wikipedia article, see if I see anything that's interesting. Okay, so I guess insulin and so it has to do with the endocrine, sustained blood sugar levels. Okay, so insulin is something that's really important. Okay. The injections of pancreatic extract reverse the symptoms produced by pancreas removal. So it seems like Eli Lilly was one of the first movers here and helped some researchers in developing this this insulin type. Also, this piano guy is pretty good. It sounds pretty good. Okay. Oh, Merck. What is tuberculosis? This is pretty crazy. Okay, yeah, that is actually pretty crazy. for tension. Maybe it's whenever you feel tightness in your muscles. So Merck is oh man, that kind of sucks. So it seems like this is one of the big reasons why FDA ended up really having a lot of power in the pharma industry. It's because of what happened here with. So who's. So it's Thalamid. Okay, Kevadon. Here it is. Okay. CGMP, okay. Interesting. Okay, so drug discovery. Novo Nordisk, that's another big one, yeah. Alright, so R&D. This one seems to be pretty important. Drug discovery and drug development. I guess this is the product life cycle I was talking about earlier. Okay, so this actually is just in line with what the primer says too, that a lot of the drug discovery does happen at universities and research institutions. Okay, so I didn't get the research institutions part. In vitro and in vivo studies. Okay. Interesting. Okay. Investigation on new drug filing. Oops. So normally an approval in the UK and other European countries comes later than one in the USA. Okay.
Thank you so much. Muchas gracias.
Okay, interesting. So, Orphan Drug Act is interesting. Merck. Bristol Myers Squibb. Interesting. one's Humera? I think it's Merck. Or I think it might be Roche, actually. Oh, never mind. AbbVie. Okay. Oh, they are top 5 in revenue generation, so yeah, they're definitely not down there. Eli Lilly. Here we go. Lipitor. Okay. Okay, interesting. Bad pharma is interesting.
Yo antes hacía eso, pero no tomaba mucha agua, ni la traba. Y hoy como estoy tomando bastante agua, me siento con energía, quiero trabajar y porque no siento pesado que comí, ¿entiendes? No sé si usted, pero a veces cuando yo como, siento pesado, no quiero cenar, pero no tener comida es que motivo porque no está pesado, sino es pura agua.
Who's Ben Golders? Laker.
Yo comencé a trabajar de los 8 años con mi papá en cosas pesadas, entonces ya tengo experiencia, vamos a decir, de trabajo.
Factors associated with COVID. Bad science. Interesting.
Pero no,
I'm curious to see what that book is talking about.
para no tener hambre y no ha tenido hambre. Los primeros días sí, porque no estaba acostumbrado. Hoy que me estoy acostumbrado, solo con agua nada. Y a veces
Okay.
me siento bien.
My computer is going to die soon.
Usted sabe, en la tienda,
Okay, so I'm gonna also add some stuff here. Useful orgs slash links slash resources West Health Policy. So let me update this. Drug discovery. Novel research is conducted to find new molecules / compounds for drug can be used to treat diseases. There are usually multiple phases for this. So there's 3 phase 1, phase 2, phase 3. So, in order to be approved, drug must show efficacy and be able to and have low side effects. So, right, I think this is true. Drugs are patented or protected by patents. How many drugs get approved by FDA? Okay, so orphan drugs. Now I know what orphan diseases are. Actually, let me write that down before. So, orphan drugs. What are orphan drugs? Drugs are used to target, treat diseases that affect a small number of people companies receive favorable compensation for all of or they're developing types of drugs. Oh man, hereditary transthyretin mediated amyloidosis. Yeah, that's tough. What is semziomide? ASMD, interesting. Insight. Okay, biosimilars, 11 different reference products. Yeah, wow, these, man, these different compounds are crazy. Never heard of any of them. Mount Haro, though, I feel like I've heard that is something. Yeah. It's done by Eli Lilly. Yeah. Okay. So FDA does publish all of the new drug therapy approvals. Turns out I would expect them to improve more, but it doesn't seem like they actually do. Center for Drug Evaluation and Research. Okay, that's important actually. Cedar. Oh, fuck. Interesting. So I'm gonna add this too, actually. Let's see if I can copy this. Copy this in here. No, I can't. Okay. So FDA Cedar Center for Drug Valuation. Links. Number of drug approvals. So the FDA approves around 30 drugs per year on average. So you can see this from the Nature article here. Okay. Oh wow, this is kind of crazy. So GSK pleaded guilty to criminal charges and agreed to a $3 billion settlement. Yeah, that's pretty wild. This is also pretty wild too. Okay. Okay, that's cool. Maybe a redemption type arc. Okay, so I think I'm going to end the stream here. After going through this Wikipedia article, I feel like there's another primer that was published by Deutsche Bank. Someone gave access to it. Someone published access to it on Reddit. So I might take a look at that later. But I also want to read through Eli Lilly's annual report again, at least their management's discussion and also their business overview, so I can still, I guess, continue to build the intuition of what's going on here. So with that, I gotta go catch a bus. Maybe I might stream a little bit later before the bus comes if I can find a place nearby. So, see you guys for now. Peace.